State leaders addressing North Carolinians meantime today as we enter a new phase of the pandemic. This comes as we see cases sinking substantially over the past 2 months. About 1,200 people testing positive for COVID-19 today, which is, as you can see, closer to what we were seeing before Omicron took hold of the region. Because of the progress, starting next Wednesday, the state is going to start updating its COVID-19 dashboard on a weekly basis rather than a daily basis. It also plans to focus on metrics other than case counts. WCNC Charlotte's Kendall Morris joining us live. Kendall, what else can we expect moving forward?
Well, Vanessa, state health leaders say we've been through this pandemic for the last 2 years. People know what to do and how to make their own health care choices. Now, as we shift to put an emphasis more on dealing with COVID-19, they say it's more about personal responsibility as we learn how to live with this virus. North Carolina focused on the future, one where COVID-19 is still around but not disrupting daily life.
We have turned the corner on this pandemic, and we believe that the worst is over. Today is about how we approach the future, the plan for preparing, informing, but also encouraging individual responsibility and empowerment here.
Starting next Wednesday, North Carolina's COVID-19 dashboard will look different. It will focus on these 7 metrics. Daily case counts no longer considered as important, with at-home tests now more readily available.
It's not information that we readily have or is reported to us. We have looked at the potential of how to get access to that information. Unfortunately, it's not something we can do with a great deal of confidence and quality. Even as North Carolina shifts into a new phase of the pandemic, doctors in the state are watching new variants closely, especially as the Omicron subvariant BA.2 causes a spike in cases in Europe.
It is thought to be slightly more communicable compared to the previous one, but again, they're seeing more number of cases, but their hospitalizations hasn't really gone up significantly.
State health leaders say they will stay nimble to respond to variants and possible surges.
We know that this virus has been able to throw curveballs before, which is why staying vigilant is important for us.
Urging the public to continue staying up to date with their vaccinations and booster to be prepared moving forward. And the Secretary for the Department of Health and Human Services says 94.3% of North Carolinians have some sort of immunity to this virus, either through vaccination or through infection. But it is yet to be determined how that immunity holds up against new variants that could pop up. Live in Uptown, Kendall Morris, WCNC Charlotte.
Kendall, thank you for your reporting.